Hi, I'm Dr. Gedia with the Neurophysiology Center. Acetylcholine is a substance in the brain that is involved in cognition, which includes memory, reasoning, communication, understanding, and overall function. Cholinesterase is another substance in the brain that breaks down acetylcholine. When acetylcholine is broken down by cholinesterase, the lack of acetylcholine doesn't allow the brain to store or retrieve memory the way it normally would. The Exelon patch provides patients with rivastigmine, which is a type of medication called a cholinesterase inhibitor. This means that when the rivastigmine travels in the bloodstream to the brain, it attempts to block the effects of cholinesterase on acetylcholine. The Exelon patch is indicated for the treatment of dementia due to mild to moderate Alzheimer's disease. It uses transdermal or patch technology to provide rivastigmine, which means it releases the medicine through the skin and into the bloodstream continuously for 24 hours. The Exelon patch demonstrated efficacy in overall function and cognition at a dose of 9.5 milligrams every 24 hours and demonstrated improvement in instrumental activities of daily living, such as performing hobbies, focusing on conversations, and using the telephone at a dose of 13.3 milligrams every 24 hours versus the 9.5 milligrams every 24-hour dose. The Exelon patch does not change the course of Alzheimer's disease. The patch is visible on the skin, and the date of the application may also be written on it as a reminder. Exelon patch reduces the number of pills your loved one has to take each day and provides another option if he or she has trouble swallowing pills.
Indications. Exelon patch, rivastigmine transdermal system, is a prescription medicine used to treat mild, moderate, and severe memory problems, dementia, associated with Alzheimer's disease. Exelon patch is also used to treat people with mild to moderate memory problems, dementia, associated with Parkinson's disease. Important safety information. Exelon patch should not be used if the patient is allergic to any component in Exelon patch, including the active ingredient rivastigmine. Exelon patch should also not be used if the patient has had a skin reaction that spread beyond the patch size, had blisters, increased skin redness or swelling, or did not get better within 48 hours after removal of the Exelon patch. Mistakes in using Exelon patch have resulted in serious side effects. Some cases have required hospitalization and rarely have led to death. Most mistakes have involved not removing the old patch when putting on a new one and the use of multiple patches at one time. Only one Exelon patch should be worn at a time. If you accidentally apply more than one Exelon patch, remove all of them and inform the doctor immediately. Exelon patch can also cause serious stomach side effects, including nausea, vomiting, diarrhea, dehydration, decreased appetite, weight loss, and bleeding in your stomach, ulcers. Dehydration may result from prolonged vomiting or diarrhea and can be associated with serious outcomes. Some people have had a serious skin reaction called allergic contact dermatitis, ACD, when using Exelon patch. Stop using Exelon patch and call your healthcare provider right away if you experience reactions that spread beyond the patch size, are intense in nature, and do not improve within 48 hours after the patch is removed. Symptoms of ACD may be intense and include itching, redness, swelling, warmth or tenderness of the skin, or peeling or blistering of the skin, which may ooze, drain, or crust over. The incidence and severity of these reactions are dose-related. For this reason, treatment should be initiated with Exelon patch at a dose of 4.6 milligrams per 24 hours and titrated to a dose of 9.5 milligrams per 24 hours and then 13.3 milligrams per 24 hours, if appropriate. If you have not taken Exelon patch for more than 3 days, do not start taking it again until you have talked with a doctor. The most common side effects of Exelon patch include depression, headache, anxiety, dizziness, stomach pain, urinary tract infections, muscle weakness, tiredness, and trouble sleeping. Weight should be checked while the person is using Exelon patch. Weight loss, loss of appetite may occur. People below 50 kilograms, 110 pounds, may experience more side effects and may have to stop using Exelon patch due to these side effects. People at risk for stomach ulcers or who take certain medicines should tell their doctor before starting Exelon patch, because serious stomach problems, such as bleeding, may occur. Exelon patch may cause fainting or slow heart rate. People with certain heart conditions should tell their doctor before starting therapy. People with serious lung conditions and difficulty breathing, bladder problems, or seizures should consult their doctor before using Exelon patch. Extrapyramidal symptoms, e.g., uncontrollable facial or body movements, including tremor and restlessness, could occur or get worse. Parkinsonian symptoms, particularly tremor, have worsened in Parkinson's disease dementia patients treated with Exelon, rivastigmine tartrate capsules. Before using Exelon patch, people should also tell their doctor about any medical conditions they have, including if they have had a loss of appetite or are losing weight, or if they have had a skin reaction to rivastigmine, the medicine in Exelon patch, in the past. People on Exelon patch who feel dizzy or drowsy should not drive or use machines. Tell the doctor about all other prescription or non-prescription medicines the patient is taking. Exelon patch should not be taken at the same time with other medicines that have a similar effect on the body and the brain, cholinomimetic agents, or with anticholinergic medicines. Inform the doctor if the patient needs surgery requiring anesthesia while using Exelon patch.
Be sure to review the full prescribing information for Exelon patch included with this DVD. In the next chapter, we'll discuss how you can apply the Exelon patch and things you need to know about helping your loved one during treatment.
The Exelon patch, rivastigmine transdermal system, comes in 3 doses. The initial dose is 4.6 milligrams per 24 hours. If your loved one is an appropriate patient and tolerates this dose well for a minimum of 4 weeks, the doctor will introduce the effective dose of 9.5 milligrams per 24 hours. Your loved one will remain on this effective dose for as long as therapeutic benefit persists. If your loved one has been on the dose of 9.5 milligrams per 24 hours for at least 4 weeks and is tolerating it well but requires additional therapeutic benefit, his or her dose may be increased to the maximum effective dose of 13.3 milligrams per 24 hours. Here are some of the things you need to remember about applying the patch. The location of the patch should be rotated so that it's not applied to the same location more than once in 14 days. You may write the date on the patch with a ballpoint pen to help you remember when it needs to be changed. Only one Exelon patch should be worn at a time. The patch should be replaced every 24 hours at the same time each day. It should not be applied to skin that is red, irritated, or cut. Gently clean the application site with water and allow it to air dry, or pat the skin carefully to dry. In a clinical trial for Exelon patch, the majority of patients experienced no skin irritation from the patch, or had mild to moderate skin reactions. The incidence of severe skin reactions was very low, regardless of dose. A direct comparison of the rates of application site reactions reported in the placebo-controlled and active comparator-controlled clinical trials cannot be made due to differences in the method of data collection employed in each of the trials. Only a very small percentage of patients had to stop taking the Exelon patch due to skin irritation. You should apply the Exelon patch once a day to the upper or lower back. However, if the back is not accessible, you can apply the Exelon patch to the upper arm or the chest. Please remember, you should apply the patch to clean, dry, hairless, intact, healthy skin, where the patch will not rub against clothing. Do not apply it to areas where there is powder, moisturizer, or lotion that could keep the patch from sticking to the skin properly. You should not open the patch until you are ready to use it. If left opened, the patch starts to lose medicine and becomes less effective. Unopened patches can be used until the printed expiration date on the package. Try to make a routine out of applying the patch so that it becomes easier for you or your loved one to get used to applying it. However, if you miss a dose of the Exelon patch, no change in dose is necessary. Do not apply 2 patches to make up for the missed dose. You may apply a new patch and resume the normal dosing schedule on the next day. If you miss more than 3 days, call the doctor's office before applying another patch. Here are some additional important things to remember while your loved one is being treated with the Exelon patch. Let the doctor know if your loved one needs to have surgery. The Exelon patch may exaggerate the effects of some muscle relaxants during anesthesia. Let the doctor know if your loved one is taking any other prescription or non-prescription medications and what those medications are. The Exelon patch should not be given at the same time as other medicines that have similar effects on the body and brain, such as cholinomimetic agents or anticholinergic medicines. The medicine is absorbed through the sticky part of the patch, so if you or your loved one comes into contact with the adhesive layer, you should wash with soap and water as soon as possible. Avoid contact with the eyes. If your loved one or anyone places the patch in his or her mouth, remove it, make sure that no part of the patch is still in the mouth, and contact the doctor's office immediately. Please be sure to review the important safety information as well as the prescribing information for the Exelon patch included with this DVD, and ask your loved one's doctor questions about any information you don't understand.
Hi, my name is Anne, and I've been caring for a loved one with Alzheimer's disease for 5 years. Like many of us, you probably never thought this would happen to someone you care about. But now that your loved one has been diagnosed with mild to moderate Alzheimer's disease, you want to do everything you can to help. It is important to work with your loved one's healthcare team to manage the disease in the best possible way. Empower yourself with knowledge and support by building a strong and open relationship with your loved one's doctors and nurses. Some helpful ways to do this include the following. Always provide accurate information about any symptoms or side effects you notice, including severity or changes. Ask questions that arise concerning the disease, its treatment, the management of your loved one's health, and anything else. There are a number of steps that you can take to help manage the treatment of mild to moderate Alzheimer's disease, and the first step is to learn as much as possible about your loved one's treatment plan. Before each visit to the doctor, you might want to prepare a list of questions to ask, and then during the visit, write down the answers provided. Don't be afraid to ask for information to be repeated. It's important that you leave each office visit with an understanding of the information that was discussed and any steps you need to take regarding your loved one's care. Find out who provides supportive social services in your community. Organizations like the Alzheimer's Association have chapters all over the United States. Counseling, education, and support groups can help you learn what might make caregiving easier. And emotional support is essential to your own well-being and that of your loved one with mild to moderate Alzheimer's disease. As for things you can do at home, it's important to think about your loved one's safety and how you can remove certain hazards from their environment. Remember, you don't have to do all these things at once, but as the disease progresses, people become less and less able to assure their own safety. Think about securing windows and doors with locks to prevent your loved one from wandering off. Keep hazardous materials like cleaners and other chemicals, knives, matches, lighters, and guns in secure places. Keep the home well lit and remove objects that may cause your loved one to trip or fall. Consider an automatic shutoff for the stove or removing the knobs to help prevent burns. Don't redecorate or change the configuration of rooms. Keep things constant. As people are now often being diagnosed at the early stage of Alzheimer's disease, it is important to try to remember that they are still the person they were before the diagnosis. While they have limitations, they also have remaining strengths. Try to figure out what activities you and your loved one have enjoyed that you can still enjoy together. Enter your loved one's world. Don't fight it. Find the humor and try to talk with them in terms of their logic. Keep your loved one engaged and continue to relate to them as a person. Talk to them. Try to figure out how to communicate in a way they will understand, even when they can't talk back in a way you understand. If being physically affectionate has been part of your relationship, hold their hand, even if they don't reach for yours. It's also helpful to begin long-term planning regarding future healthcare and legal decisions for your loved one so that you can eliminate some of the stress from these decisions later on. If the person is in the early stage of Alzheimer's disease, he or she can participate in making these decisions. Keep copies of all important papers, such as your loved one's will, health insurance cards, and financial information in a safe place, and make sure they are all up to date. Learn about the benefits provided by Medicare, Medicaid, and other forms of insurance. Establish who will be the decision maker in the event that your loved one is unable to make decisions. Talk with an attorney experienced in elder care issues about how to plan for legal matters, such as power of attorney. Consult a financial planner for help with investments or long-term care coverage plans. Caregivers like us play a very important role in the lives of people with mild to moderate Alzheimer's disease. Your efforts help make the life of your loved one as comfortable as possible. While being a caregiver can be a rewarding experience, it can also be a difficult one. It can sometimes require an incredible amount of understanding and patience. That's why it's important that you take time for yourself. Exercising, eating healthy, and socializing with friends are good for your overall well-being. Even just taking a few minutes each day to close your eyes and take a deep breath can be soothing. It's important to remind yourself that you are doing everything you can, but that you need to look after yourself as well. Here are some helpful tips for caring for someone with mild to moderate Alzheimer's disease while also taking care of yourself. First, don't take your loved one's actions personally. Remember that their brain is working hard to try to make sense of a world that isn't the same for them. Try to be patient. If they sense your impatience, it increases their anxiety and reinforces the fact that they can't function the way they used to. Don't be afraid to ask for help from the people around you. Your friends and family can be the best resources you have. And when you're caring for someone with a chronic illness, one of the best ways to relieve feelings of tension or stress is to talk with close friends and family about any issues you have while taking care of your loved one. Find a caregiver support group in your area. It may help to share ideas and concerns with other people who are going through similar experiences. Look into community support options that might help to ease the burden on you, such as visiting nurses or Meals on Wheels. It's important to stay on top of how you are feeling emotionally and physically. Your dedication and devotion can wear on you if you don't respect your own needs. Keep the balance between your own life and your life as a caregiver in perspective. Ask friends and family for help as soon as you know you need it. Don't wait until you are exhausted. For example, if you need help taking your loved one to doctor's appointments or social activities, ask someone to come along with you. Or, if the time you spend caring for your loved one makes it difficult to run errands or do things around the house, ask your friends and family to help with grocery shopping or housework. Try to maintain some of your own interests and find time to chat with family and friends about ordinary things, not just caregiving. Be sure to maintain your own health. Keep up with preventive doctor's visits, dentist appointments, etc. Time spent reading, relaxing, or listening to music can help you relieve stress. If you find yourself unable to speak about your feelings with anyone else, try writing them down in a journal to give yourself a personal outlet. You should consider seeking professional medical help if you are overwhelmed by feelings of depression or anxiety. Thank you for watching. Speaking as one caregiver to another, I'm happy that I can provide you with some advice.